Thank you, Mr. Chairman. And before I begin my remarks, I just want to thank Chairman Grassley and Senator Leahy, Senator Klobuchar for their support and their work on this bill and on today's hearing. I also want to thank their staffs who have all worked tirelessly together to make this bill come together the way that it has. The subject of our discussion today, the CREATES Act, and our attempt to end anti-competitive abuse of FDA safety regulations is an important one. 9 months ago, when this subcommittee held a hearing on two major health insurance mergers, I noted at the time of that hearing that while vibrant competition in every industry is important to our economy, consumers and policymakers pay special attention when healthcare is involved. This is because consumers in this market are not just consumers, they're also patients. Or in some instances, they're caregivers or their mothers and fathers making life-changing decisions that impact their personal life as well as their economic well-being. Undoubtedly, the most frequent example of rising costs in healthcare involves prescription drugs. Nearly everyone has a story about sticker shock of one sort or another at the pharmacy counter, or anger upon learning that the drug they need isn't covered by their health insurance, or frustration that no generic version is available of a drug that they have come to depend on, and no generic alternative has hit the market. In response to these concerns, Congress in 1984, led by the senior senator from my state, Senator Hatch, passed the Drug Price Competition and Patent Term Restoration Act, also known as the Hatch-Waxman Act, to facilitate and encourage the increased entry of lower-cost generic pharmaceuticals. The result has been a drastic increase in generic entry and billions of dollars in savings to consumers and to the government itself, and therefore to taxpayers. Yet increased competition doesn't always sit well with incumbents, and unfortunately, complex regulatory environments are often rife with opportunities for manipulation and abuse, the type of abuse that is intended to enable an incumbent to avoid competition or to insulate an incumbent from the price-lowering effects of competition. This is exactly what has happened with certain prescription drugs. When Congress passed the FDA Amendments Act in 2007, one of the things it intended to do was provide the FDA authority to ensure certain dangerous drugs were handled safely and responsibly in order to protect patients and in order to prevent the type of misuse that would be dangerous. To do so, it created the Risk Evaluation and Mitigation Strategy Program, or REMS. A REMS program can take many forms, but one element it may include is restricted distribution. In these situations, a drug is not necessarily sold through the normal supply chain, going to third-party wholesalers who in turn sell it to pharmacies and sell it to hospitals. Instead, the drug may be distributed directly by the manufacturer or through a specialty pharmacy, one that sells only to patients with the prescription. Some companies realized that they could take advantage of this situation. When they have a drug that is subject to a REMS program with restricted distribution, they can use it as a sword of sorts. They can use the REMS program as a kind of excuse to deny samples of the drug to potential would-be generic competitors. Now, these samples are significant because the samples are necessary for the would-be generic manufacturer to conduct the testing that's required by the FDA pursuant to the Hatch-Waxman Act, the act whose entire purpose was to increase and facilitate generic entry into the market. The CREATES Act, which stands for Creating and Restoring Equal Access to Equivalent Samples, aims to end this type of abuse by providing two causes of action by which generic competitors can gain access to samples and ensure that they're not excluded from a REMS program. While some parties have attempted to use the antitrust laws to address this conduct. I believe it's better characterized as a competition policy problem stemming from a misuse of government regulation. In these situations, the answer is not to pile antitrust enforcement on top of regulation, but rather to fix the underlying problem, which is the law itself and the particular aspects of the law that are being manipulated. I believe the CREATES Act does just that, and I'm hopeful that it will become law and that it will lead to increased competition and ultimately to lower prices for consumers. So again, I want to thank Senator Leahy, Chairman Grassley, Senator Klobuchar for their leadership on this issue and their support for this bill, and I look forward to hearing from our esteemed panel of witnesses. But first, we'll hear from
Senator Lee. Okay.
Senator Klobuchar.